everyone, and welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by two board-certified plastic surgeons. I'm one of your co-hosts, Dr. Ashley Amalfi, and I'm in Rochester, New York, and I'm joined by my dear friend and colleague, Dr. Smita, who's in New Jersey, and we are excited to continue our top 3 series, right, Smita?
I'm so excited. This is probably one of our best ideas, Ash. I mean, we're just
we have
a
lot of good ideas. I don't know.
We have a lot of good ideas, and I think this is one of our best. I mean, there's so much fluff and noise when it comes to plastic surgery, and I mean, despite how good social media is, there's just a lot more extra noise out there. So we're just going to tell you the top 3 things that you guys need to know about all of the big procedures that we do.
Yep.
And
boiling it down.
And then you're just we're boiling it down. Like, This is the what you really need to know. Everything else is just extra.
Yeah, we got you. We got all the big things here. So ready?
Exactly.
What you want to tell them what we're going to talk about today?
Yeah, so today we're going to talk about breast lifts or mastopexy. So this, I think, is such a common procedure, especially as we age, our breast tissue changes, or after pregnancies, breastfeeding, natural part of just our breast journey. But there are ways to sort of improve the shape, improve the fullness, lift that nipple back to the center of the breast. So that's where a breast lift comes into play. But there are certain things to know. And the first, I think, is probably one of the most important because so many people are scared about this and nervous about this. Wouldn't you agree?
Oh, absolutely.
I'm going to let you introduce it.
Yeah. The first thing to know is there is no way to lift a breast without putting scars on the breast. We do not have any sort of magic. The only way to change the shape of the breast with a breast lift is to put scars on the breast. The scars are beautiful and they will probably heal very, very well. And that's why you're coming to see a plastic surgeon to do this sort of thing. But there will always be a fine scar. And scars fade and they mature and they look beautiful, but they never, ever disappear. And so that's just something that you want to understand because everyone always thinks there's some sort of secret way to do it without. But there's not. There's just really great ways to do the procedure so that patients heal really, really well. Would you agree?
Yeah, I agree. I mean, I think, this is literally one of the most common things that people are nervous about. It's not necessarily the surgery. It's just the scars, right? You sort of get this Frankenstein image in your head when you think about scars, But the scars on the breast heal so beautifully. So typically when we're talking about a breast lift, we sort of talk about the lollipop incision scar, which is around the areola and then up and down the center of the breast from the areola to the crease, or the anchor incision, which includes along the crease. So it looks like an anchor.
Right.
So it's seemingly, it seems like a lot of scars, but the shape of your breast, which is your main concern really at the end of the day, right, is getting a better shape and contour. There's always going to be that trade-off.
Right.
The good thing with seeing someone who's a board-certified plastic surgeon, I mean, we are the experts in scars and making sure that scar heals well, is in the right places, is camouflaged. And so those scars heal beautifully.
Yeah.
Despite how much, scar there is, it just heals beautifully.
Yeah. We'll show you, we'll show you pictures. We'll show you, because a lot of times when you're looking online, you're going to see really early pictures because people are really excited about their shape. But then the scars can be pinker and redder at that 3-month mark. So we'll show you when you come to the office some more mature scars in photographs. And I think, patients then, you usually see them relax because they look at them and they're like, oh, wow, that looks absolutely gorgeous. You can't even notice it. And that's just what they want to know. So yes, is it always there? Can you always find it? Yes. But even us, even if Smita and I are doing a revision surgery, sometimes those scars are so beautiful, they're really hard for us to find. So is it there? Yes. But does it usually heal very, very well? Absolutely.
Right, absolutely. And I think you sort of bring up a good point, is that you want to sort of look at your long-term scars, right?
Yes.
So at 1 year, after 1 year, I always tell people they're going to look bad before they look good. And that's just, how we suture everything, right? There's a rhyme and reason, like why we stitch things up the way that we do. But as they heal, they might get dark, they might get red, they might be a little raised, but they will sort of fade into that thin line that's your skin tone. So that's what you sort of have to look forward to.
It's a process, and we're going to tell you about what to anticipate so that you don't get worried. But absolutely, it's a process, and when you're patient, they're going to probably look really, really great when you're done. And we hear about scars in the beginning, but then we don't hear too much about scars afterwards because people are so darn happy with their results. And that's what you're looking for. You know, we have that conversation up front, but hardly ever do we really have that conversation again because the results are beautiful, and that's what you guys are here for, to have a beautiful shaped breast.
Well, and the thing also is that, let's say, you know, in the rare instance where that scar is not doing what we want it to do, there are ways that we can address it, right? So it's not like you're stuck there. There's lasers, there's microneedling, there's revision. So, I mean, just scar treatment, whether it's creams or silicone tape or whatever it is, I mean, there's things that we can do to even further improve the quality of the scars. So, I mean, I know you haven't, I certainly haven't had patients regret doing it because of the scars. Everyone's been happy. They've always wished they did it sooner, you know, rather than being so nervous about the scars. So that is number one.
Number two.
Go for it.
We like to tell patients that we reset the clock, but the clock still ticks. So gravity is still going to work. We're going to lift your breast. It's going to be perky and tight and absolutely adorable. But we have not figured out how to stop gravity. And so tissue is tissue, and tissue is going to fall with time. So even though we've set the clock back, that clock still ticks, and your breast will still age. We've just gained a few years and set you back to sort of that teenage breast perkiness, tightness. And so that's why you get really natural but beautiful results with a breast lift.
Right. I mean, I think it's so funny because, I mean, I wish we had a cure for gravity, right?
Yeah,
that would solve so many issues.
Yeah, we don't have forever.
We don't have a forever, and at the end of the day, our skin is skin, and it will stretch. It does everything that it normally does, and there isn't really anything we can do about changing our genetics and our skin quality and gravity and all of that. But we can just improve the shape, improve the contour, and reset things. Gain a few years, 10 years roughly, I think, sometimes.
I mean, I guess the only new exciting thing is, you know, surgical scaffolding like B4HB, like Galaflex, which is sort of that internal scaffolding that can help support the tissue. Gravity's still going to work, but something like that is really the only tool we have to help your skin be a little bit stronger. But all in all, skin is skin, and, you know, gravity is gravity, and things are going to continue to age. But we'll talk about that very realistically in your consult, so you can understand, like, what's it going to look like afterwards, and what's that process going to be. Because, again, everyone's skin is totally different. And we need to see you and evaluate you, and we can help you understand what that long-term result is going to be like for you.
Right, exactly. I mean, I think that's so important, too, because I think in general, right, patients that come in for a breast lift, their skin has already shown, like, it's already stretched.
There's a reason you're there, right? Because not everyone needs a lift.
That's why you're there. Yeah, not everybody needs a lift. You know, there are people that breastfeed and do all, you know, age and don't ever need a lift, and they just have different quality skin. So once you've already sort of proven yourself into that category that needs a lift, well, then we know that that's still going to continue. We're just improving things
exactly
in the long run, right? We're setting things back a little bit. So that's always important to keep in mind. And number 3, also so important, is your size. So your size is still going to be the same after a breast lift. We are removing extra skin. We're repositioning the nipple. If anything, it might almost have the appearance of going down a cup size just because you're so used to seeing your breast like super elongated and like oval shaped, and now it's round, it's perkier, it's sitting back up on your chest. So it gives you that appearance or sensation that you've gone down, but in reality, we're not really changing the cup size.
Right.
And the only way to do that, if you do want a larger size, is with an implant.
Right.
So adding an implant at the time of your lift.
Yeah. Yeah, so we're really just reshaping you. And if you want to be bigger, that's absolutely fine. But we have to add something to get you bigger. And an implant or fat is really the only way that you're going to make that breast a little bit fuller. So just something to think about. I mean, we can go down. So when we're taking out skin, we can take a little bit of tissue. So if you do want a reduction in your cup size just a little bit, you can definitely accomplish that with a lift. But we just can't get bigger unless we add something. But we can certainly subtract a little bit if you're a little bit larger than you want to be. So that's reasonable.
Right. Yeah, I think so too. And I think a good way to sort of gauge that is I often ask people, when they come in or if they're sort of on the fence where they're not really sure, I'm like, okay, well, how do you feel when you wear a bra that actually fits you, which oftentimes we don't.
Yeah.
But when you do you like the size of your breast when you're in clothing,
Yeah.
Because that sort of gives you an idea of that breast being lifted. But if you do want more fullness, if you want more cleavage, I mean, you can add an implant without really increasing the size of your breast. It just gives you more of that upper pole fullness. Or if you just want to be bigger, then that's where that implant comes into play. So there's lots of nuances, which is why, again, it's so important to see a board-certified plastic surgeon because we can talk to you about all of this, whether it's a lift, a reduction, a combination of a lift with an implant. I mean, we're so well-versed in this, and we can really talk to you about what your goals are, what your concerns are, and what options you have.
Awesome. All right, you guys. Well, I hope you know what you got to know. Top 3 things that you need to know about a breast lift. So excited for this series. Make sure that you subscribe so you can check out new episodes every week on YouTube and Spotify, Lipstick and Lipo, and we will see you guys soon.
We'll see you next week. Bye, guys.
Bye, Smita.